Roots on TV, oats porridge, hard-dough bread, a sip of herb tea for breakfast. I remember to wipe my mouth at the bus stop on Roundhay Road, where I walked a short Grace Jones Afro style, black girl pride channeling my steps. I rode 2 buses to Bramley Town End just to get to school. At intake high, during class registration, the teacher asked, "Who watched Roots on TV?" And me, the only black child in class, screwed up my face, kissed my teeth at classroom laughter, cut my eye at Janet Whitehouse, sat next to me, scribbling NF on her desk. A white girl pride. At intake school, not one hard-dough bread eating kid in my class, just chips and beans, NF and British movement followers, propelled spits, taunts in Yorkshire, slurred names, chocolate drop, nignog, sambo, jungle bunny, gollywog, kunta kinte, kizzy, go home. Mum always said she should have gone back home when rivers of blood ran deep in the current of Enoch Powell's hate, the Tiber foaming with blood, an urgent encouragement of re-emigration. Send them back, load the ships with chocolate smiles and send them back before blacks take the whip hand. No blacks, no dogs, no Irish, 1 down and 1,000,000 to go. But unabanya, Mum said. I sweep the Union Jack under the bed.
My name's Sarah Erskine. I'm Head of Mental Health in the Public Health Directorate in Leeds City Council. So in effect, I head up a programme of work around reducing the risk of mental health problems, improving access, experience and equity, and influencing what happens in services, and also promoting good mental health.
My name's Sharon Prince. I'm a clinical and a forensic psychologist. I'm the Deputy Director for Psychological Professions at Leeds and York Partnership NHS Foundation Trust. I started on this journey with a passion of knowing about overrepresentation, and it all started when Sarah and I met. I met Sarah, then we met with Sinead, and we came together to think, what can we do about this? How can we make a difference? We recognised this was and this predated COVID, predated the Black Lives Matters and before George Floyd. So for some years we've been on this journey together to think about how can we make a difference in Leeds.
I am Sinead Cregan, Director of Development and Innovation at Inspire North, a large North of England charity, and we provide mental health accommodation, we provide supported accommodation, we work with perpetrators of domestic abuse, and we also provide a domestic abuse refuge, and we also work with younger people with dementia. So a real wide range of services. And we're also a housing association, so we have our own accommodation that we provide as well.
In Leeds, as with elsewhere in the country, people from some diverse communities are more likely to be detained under the Mental Health Act. And in Leeds, if you're from a Black population group, it's almost 3 times as likely as someone from a white population group. And if you're from an Asian background, it's around twice as likely. So that's the situation at the moment. And it was the situation when we started this work in 2017, when we tried to start to have conversations about how we address the overrepresentation of some diverse groups detained via the Mental Health Act. It was really, really challenging. It was very difficult because there was a lot of anger and distrust, and we didn't really have the language to talk about it. And it was at that point that a couple of people in Leeds had heard about the National Synergi Collaborative Centre, and we started to make connections with Joy and with Cam and with James. And it was through talking to them really that we understood that the confusion and the complexity and the conflict was actually part of the process.
Prior to taking up this role, I was employed, as I said, as a commissioner manager within the council. And I've been doing that role for quite a long time, which meant I knew a lot of people in the city. I also knew people regionally and nationally because of the role that I undertook at that time. And that put me in touch with a real variety of people that came into the city to look at our strategic work. And I was heavily involved in the development of the Leeds all-age mental health strategy. And part of that was looking at, obviously, the higher incidence of detentions using the Mental Health Act and BAME communities. And I got involved at the very early stages of the City Council engaging with Synergi, and was heavily obviously involved in the delivering of the first session that we had at the art gallery with Synergi and others. And it felt really natural for me to take that connection with me into my current role because there was an absolute crossover.
Synergi's formulation of the problem, which is, service user voices, experts by experience, their voices have been silenced because it's too difficult. We don't have a shared language around this. People in bureaucratic systems and white people often move away from trying to address this difficult problem because it's too difficult and it's too challenging. And that was really, it felt revolutionary to have external partners say that this is part of it and this is the formulation of the problem, and therefore the solution might be the opposite to what that problem was.
And so we all, as a city, have made a commitment to try and do this together in a way that feels different, feels authentic, centres service user voices, and has those uncomfortable conversations.
The priorities for us from a public health perspective and from a Synergi-Leeds perspective are around developing action and supporting community action that reduces the risk of severe mental illness, that improves trust between communities and statutory services, and that builds what we call psychological capacity within communities. So understanding of how mental health systems work and really importantly, feed through from what communities are saying into mental health services. That's a really important priority for us. The second thing really is around continuing to grow and develop the Synergi-Leeds network, because this is a place where people can come together and feel supported around trying to address racism and discrimination as it manifests itself in services, but also maybe the results of racism and discrimination on mental health. Very early on in the process, we held a Creative Spaces event, and people told us from all walks of life and all parts of the system, people in education, people in community groups, that they felt very alone and they felt very isolated. So enabling people and supporting people to come together as part of that network, that community of practice, and for them to feel energized and supported to go back and make changes in whatever part of the system they work in.
We've had a number of creative spaces events which have been co-created with service users and have felt really powerful. We've engaged city leaders in thinking about how do we tackle ethnic inequalities, mental health inequalities together. It's about collaboration, it's about relationships and seeing people for who they are, and unless you engage in people's lives and stories, then why would you do things differently?
I mean, I think in terms of Inspire North, myself being part of our senior leadership team, the murder of George Floyd affected all of us in a variety of ways, I suppose, personally, passionately, and also professionally. So we felt acutely that we had to do something, and rightly so, our BAME employees were coming to us and saying, what are you going to do? What's our response to the murder? How are we going to respond? Because it's not sufficient to say we've got policies, we try to be an anti-racist organisation. That wasn't sufficient. We knew we needed to do something really differently on so many levels, to address how people felt about that murder. And so we decided we were going to use it as an opportunity, really, to think about what we do as a group. And we decided that we were going to start to think about how we would become more anti-racist, but how we could actually evidence that, make it something that was really practical, that we were prepared to take that on, even though it was going to be a tough journey, because we knew it would be. Part of it's about individuals, but it's also about what's in your culture. And if you haven't got anti-racism established within your culture, you're not going to leave any legacy.
I'm Dr. Nuwan Dissanayake, and I'm a consultant psychiatrist, and I work with the Assertive Outreach team in Leeds, which is a team that supports people who have psychosis, who have struggled to engage with services or to be engaged by services, who have a history of lots of admissions to hospital. And I'm also the Associate Medical Director for Mental Health Legislation in Leeds. People who are not involved in the application of the Mental Health Act see the problem as one of happening at the point of detention. And there is certainly bias at that point. So if you look back, we see, for example, the case of Orville Blackwood and the review into his death in 1993. And that was subtitled Big, Black and Dangerous, and that was because there was a recognition of the bias in individuals and in institutions towards black men and their perceived risk. And I think people who are not involved in the application of the Mental Health Act see that primarily as the problem sometimes. There is no doubt that it plays a part, but I think we're starting at the wrong end. By the time we get to detention, and as somebody who is involved in that process, people are generally pretty unwell at that point. So what we do need to go back to is, where does it start? And what are the problems that lead to that? And this is harder for people to grasp, because we then start to focus on structural and institutional racism as opposed to individuals. There have to be some changes, I think, to how services approach people from different backgrounds. So if we show in Leeds that we have far more people from minority ethnic backgrounds in the acute pathways, and we did some work about that. But we have less people here, I think, in the psychological therapies, for example, and accessing services in the first place. It has to start with kind of listening first to how things really are. And my profession is terrible at this, in my view. I became involved in the work that I'm involved in because of that, because I had gone to explore what the world of psychiatry thought about this, and actually there was a denial of it, almost like climate change denial, with people saying it wasn't about ethnicity, it was about people's levels of social support, and about risk, and about genetics, and about all sorts of different things, rather than ethnicity being a major thing. So that's a step forward, I guess, in terms of at least acknowledging that. But then how do we then turn that into something that means change on the ground?
I'm Jim Barwick. I'm the Chief Executive of the Leeds GP Confederation. What the GP Confederation is a network of general practice. There are 94 GP practices in Leeds, and they are within 19 primary care networks. The Confederation is a mechanism of bringing all those practices and those primary care networks together to improve the quality of general practice and how general practice fits with the rest of the health and care system within Leeds. Health inequalities have become more and more pronounced during the pandemic, and they have particularly affected people from ethnically diverse communities. The first thing to do is to understand the impact of that, and that's through direct experience from people, direct experience from the clinicians who work in general practice and broader primary care, but also understanding things like the data, the information, and combining both of those things give a really good appreciation of the actual impact on people and the scale of health inequalities. Certainly what we're seeing in general practice is a significant increase in mental health problems. Whilst there are mechanisms to support people with mental health, the demand on those services remains very significant. We have a mental wellbeing service in Leeds, which is made up of the Mental Health Trust, general practice, the third sector, etc. And some of the things that we've observed through that service has been, for people from ethnically diverse communities, their recovery through mental health is slower than from other groups. So we've put more energy and focus into what makes that recovery slower and can it be improved. So that will be changing the techniques and approaches around mental health, particularly lower level mental health. One of the other things that we have done around mental health is put in community counsellors particularly from black communities that are specifically there to support people with mental health on the ground. They're known in the community. We need to move out of what's typically a third sector type approach. We need to move out of the short-term funding for pilots to a more substantive, strong, fundamental part of the health and care system in order to address these really difficult problems, because for those individuals who suffer, it's shocking that they have a different experience to others in society, and this is why it needs to be a whole system approach.
My name's Heather Nelson. I'm the Chief Exec of Black Health Initiative and also a member of the NHS Race and Health Observatory. Black Health Initiative is a community engagement organisation, and we're here working to address the inequalities and inequities that we find in education, health and social care. We focus very much on, predominantly but not exclusively, the black communities that we have here in Leeds. And we recently set up our mental ill health service. And it's very much about the black community because of the cultural taboos and issues that mental health has attached to it within those communities, for all sorts of different reasons, be it faith or family connections, So what we had to do was actually start in a non-traditional, as in non-European way of actually addressing those issues. So our outreach is targeted and it's effective communication as well. So we will speak to people not necessarily just about mental health initially, but about their health. How are they handling with the stresses, especially during the pandemic and with the visible murder of George Floyd. We are traumatized repeatedly when we are seeing the negativity that's happening towards us. When you look at the stats that show the stop and search incidents, but not only the statistics, it's lived experience, because we work amongst these people. We understand, I am one of those people. So of course, it resonates more to us. So what we did was sought funding so that we could have counsellors that look like us, but actually have our culture, so that they don't have to, those who are accessing our services, don't need to explain mannerisms or terminology because it's already known. And sometimes that in itself is a barrier to accessing mainstream counselling. Now, I've been working very closely with a few of the leaders in the various sectors about service provision and saying we're always talking about one size doesn't fit all, but unfortunately we're still using that one size. And to get rid of that one size, we cannot have the same people around the table all the time. because it's going to be the same thought pattern throughout. If you want effective change, then you need to go out and listen to people, be involved with those people, and actually have those with lived experience or those who are working within those communities sit around that table as well. How often do we find that those leaders understand us as people? And let's be very specific about black people. There's never usually translation for black people. Yeah? However, as much as English may be our main language, I'm of Jamaican heritage, for me to sometimes to express myself, I go back to where my foreparents and parents come from to explain that. But I know that doesn't necessarily work. I can give you a good example of that. A couple of years ago, we had one of our elders come to us and she says she thinks she's got sugar. So I said, okay, you need to go to the doctor. She went to her GP, said the same thing. He literally rang me while she was on consultation and said, why is this woman here when she's wanting sugar? And I'm like, no, what she's telling you, she thinks she's diabetic.
Colour. Colour has become a buzzword again, and I hate this term, a man of colour, I am sick of being stuck between gay racism and black homophobia. It is tiring, this tug of war between the colour of my skin among the homosexual community and sexuality among my ethnic community. I've been shackled in the chains of shame for an eternity, and if the word is the truth, then let this spoken word set me free. Let every syllable in my poetry express the pain of each stone thrown at my glass conservatory. I am shattered. I am the blood that colours my muscles. I am the veins that transport the plasma in my blood vessels. I am the audible sound of blood pumping, the dull thud of eyes perpetually judging. Can I be seen, or am I as invisible as the lens through which you are watching? I slump further in my seat as I try to disappear, but I only resemble jelly, as unstable as the water that swells in my belly, wind in the willows. I am the years of pain that flow down my back and into my Thames Valley. I splutter and choke on the litter strewn across my surface, though I call out to God as the congregation calls me blasphemous. For I am the metamorphosis of the Father, the Son, and the Holy Ghost. I can feel my blood trickle, the lamb, my body the sacrifice, for I am my flesh. Where do you look for yourself where the screen depicts you as a demon, a vagrant, a thug? Everything that is wrong with this earth, that ethnically covered mug. But I am depleted, empty. I have no more fight to get you to move, to get you to budge. Your surface burns as callous words beam across. But the scars no longer smudge. That chip on your shoulder that growls like the sound of grinding gears when you let up on the clutch. Is my shade of brown too much for you, sir? Would you prefer I tone it down? He frowns and I smile and wait for the I am not racist retort. Today the living is easy, really. You think the book can be read so simply. I'm an assortment of shades and artistry that combine to create Westminster Abbey. I am the smooth yet hard exterior, the beauty of light that shines through my two stained glass windows, for I am my skin. Turmoil. You live with turmoil scattered across you like the soil in a farmer's field, planting mustard seeds in the hope that you may take refuge under its many leaves. Never realizing that the shade brings all manner of creatures ready to deceive. Beware of false prophets, those that are more willing to deceive. But it's never been that hard to read me, the ultimate fiction novel. One narrates a story that they are meaningless, so they pursue everything till it's all pointless. You keep trying to dig up roots that never grew, so you sink to the calls of the devil while clutching at straws as strangers bore holes. For I am the pain, for I am the confusion, for I am the light and the living, for I am my soul. My eyes are open, but I can't see the wood for the trees. I mean, I feel like those golden leaves that are falling in the autumnal breeze. Disposable, temporary. I guess that's what happens when you're displaced and cut off from your roots. I let Western screens bleed through my porous mentality till I believed the fruit fell far from the tree. So, I started to decompose before her very eyes. Because colour has become a buzzword again, and I hate this term, a man of colour, I am sick of being stuck between gay racism and black homophobia. It is tiring. This tug of war between the colour of my skin among the homosexual community and sexuality among my ethnic community. If I have been shackled in the chains of shame for an eternity, and the word is the truth, then let this spoken word set me free. Let every syllable in my poetry express the pain of each stone thrown at my glass conservatory. For I am shattered.
My name is Joy. I came to the UK in about 5 years ago, came to do my study and decided to have my family here. I'm a Ghanaian and I live in Leeds. I'm a mother with a child. The situation that first put me in touch with the health center in Leeds was an occasion last year where I went to the hospital about my heart beating very fast. So I explained how I was feeling and I was offered some sort of treatments, which could help, calm my heart down. So the doctor explained the procedure which was done by an injection and made me aware of the possible side effects, which he explained and was a bit unpleasant. He explained that I may feel like I was going to pass out or maybe some other side effects. In total, I was given at least 4 injections and it was really terrifying. I felt like I was dying. I thought the effect of this could be immediate and short-lived. However, they continued until I went home. I felt my heart, I felt my chest stretching out, feeling like I was breaking, and I felt very strong, strange sensation in my head. So I began to feel very anxious and not of myself. I felt frightened to be alone and worried that I was going to die alone. My sleep had been affected. I had struggled to sleep and wake up terrified. I even began hearing voices saying that something bad was going to happen to me. But fortunately for me, I had a friend who was a nurse. So I contacted her and she told me to go back to the hospital to see the doctor. So I went to the hospital, not knowing what treatment they were going to give me. So whilst I was there, my friend who was a nurse spoke to the doctor, who told her that, in fact, I shouldn't have been given that injection, but that I was fine and they planned to discharge me. She said she had to plead with the doctor to keep me in the hospital and observe me in light of this. So in fact, this was what happened. This was the situation that happened to me that made me brought into contact with the health service. I was misdiagnosed with the speaking in tongues as a mental issue because when I went to the hospital, after they told me all this, I'm a Christian. I believe in God. My faith is in God and I come from a Christian background. So they told me that this was what was going to happen. I had no option than to speak in tongues and believe in God for a breakthrough, because if a doctor have told you something like this, that you feel like you are dying or you are passing out, my only belief as a Christian is to pray for for intervention. So that was what I did, and they thought that I was really getting out of my mind, but that wasn't it. I was praying to God. I remember one of the nurses was like, oh, she's praying to God. She's praying that probably she's a Christian. I was so released from the trust team, they helped me, and I believe that they supported me very well, and I was given the opportunity to explain how I was feeling, because the doctor spent a lot of time with me and told me that they could do something about. They told me that it will be better for me to speak out my cultural issues to them. So it was very helpful because it helped me to talk about my culture and my faith in God. Not only the medication aspect, but it also brought me to the point that, okay, I'm being listened to. I have people that are backing me. So I don't think I could have opened up as much about that when I'm alone. But because the trust came in, Heidi, Wendy, and other partnership, they came in and then they supported me. So I came out and they understood where I am coming from, my culture and my belief.
So I'm Khalid. I come from Northwest, and I moved to Leeds to study. Touchstone has been one of the main organisations I've been involved with for support throughout COVID, and there's been many ways they've supported me. For example, the actual ethos of the organisation is keeping the service user included in all aspects. For example, there's other stuff like lots of men's groups that I'm involved in, and these really contributed towards my mental health and well-being. Especially when you're living alone, isolated, is a whole different perspective. And having that kind of regular update with a group that you feel part of, it's like another family you've got, a surrogate family you've adopted, basically. That's how it felt like. And they keep saying, there's not enough funding. It's just horrendous to hear. There's lots of funding. I've seen so many groups, in the majority groups, where they can facilitate so many other things. Why is it not happening for the minorities? Why not? Men being 3 times more likely to commit suicide. This should be highlighted, especially in Leeds, which has the highest suicidal rate for men. So, although I'm talking about minorities, there needs to be more done for men as well, because that's why we have these men's groups. That's why we have these safe spaces for men to come and discuss, because it is okay. Just because you are a man does not mean that you cannot share what's on your mind. So I feel like these barriers need to be broken. The one thing that made the main difference for me in actively engaging with these services is the lack of judgment. For example, you come in, it doesn't matter where you're from, doesn't matter what language you speak, doesn't matter how educated you are or not, to be treated fairly as a human being. And we're all human beings, so we like to see that being put into action.
My name is Arfan Hanif. I'm the Chief Executive of Touchstone. Touchstone is a mental health and wellbeing charity and service provider, and it started off with 2 social workers in a terraced house 40 years ago to provide some community-based support, shifting the mental health intervention away from hospitals. And 40 years later, we are 250 staff. We serve around 10,000 service users across Yorkshire, of which a third of our service users come from black minority ethnic background. And in terms of our staffing, around 40% of our staff come from black minority ethnic backgrounds. And we provide over 3 dozen different mental health intervention services, right from the preventative side right up to working with people with severe needs in hospital. And that's what Touchstone is, but our heart very much remains in the community because that's the origins of Touchstone. So I'm still currently a service user. I recognise that I have a mental health condition. I have a bipolar condition which was diagnosed about a decade ago. However, my pathway into this diagnosis was quite traumatic. I was sectioned under the Mental Health Act about 10 years ago. And at the time, no one really told me what was going on, whether I was being assessed or not. I was shifting from one building to another building. The police were involved. And it felt like being a victim rather than someone who was being cared for. And whilst I was in hospital, one thing I did notice was the majority of people in the hospital setting, which were patients, were black, minority ethnic people like me. And I know we're not the majority in society. And more significantly, the majority had been forcibly brought into the hospital by the police. And of the white patients, quite a few were voluntary, they were brought in. And in my own experience, 2 days before I got sectioned, I actually went into crisis into the hospital looking for support, and I was ignored. Yet 2 days later, they deemed it high risk and brought the police to my house and took me away. And during that night, they took me out of area of Leeds. So that was quite a traumatic experience. However, through that pathway, understanding the mental health system from a hospital setting and then shifting into the community-based mental health, and bit by bit I moved into Touchstone as a service user. I was in this very building 9 years ago, and that created a pathway to where I am today. It's through that experience that I became Chief Executive, not due to any professional background in health or social care or mental health. And the reason why I became Chief Executive is Touchstone can never lose sight of what it's about. It's about ensuring that the service user's voice is heard. We're also recognising that the voices of black minority ethnic groups is never lost. And part of my responsibility is to ensure from my own experience, but also to advocate on behalf of others, that these voices are never lost. So I'm now in a fortunate position where I can sit in senior decision-making meetings and quite rightly with experience, to share what I think things can be improved.
Hi, my name's Ellie Rogers. I'm CEO at an organisation called Leeds Gypsy and Traveller Exchange. We are a community members organisation for gypsies and travellers based in Leeds, West Yorkshire, but we deliver our work across all of West Yorkshire. And we exist to address 4 main issues that the community face, which are accommodation, health, education and social inclusion. Gypsy and traveller communities face some really severe inequalities when it comes to mental health. I started working at Leedsgate 7 years ago, and that was really apparent to me as soon as I kind of came through the door. Just the amount of suffering that there was in the community around mental health and how little support people had access to. Gypsy traveller people are often not thought of as an ethnicity. Really, for our members, this has just meant a persistent experience of being left out, I would say. And I think it's been our ambition to try and raise awareness of the issues that gypsies and travellers are facing and make sure that they are represented in, things like health needs assessments, mental health needs assessments, strategy, policy, because really it starts there and it trickles down, doesn't it? So if you're not seen at that level, then you're not going to be seen in sort of accessing services. We did do a piece of work when the mental health community services were being recommissioned in Leeds about how many gypsies and travellers were accessing that service, and at the time it was 0. That 0 people registered from a gypsy and traveller ethnicity. So yeah, we've worked really hard with our partners in the statutory service to try and address that. Now we've a mental health support worker funded and based at Leedsgate, which is brilliant. And I think a lot of this work has been really strengthened by our relationship to Synergi. So Leedsgate have been involved in the Synergi work in Leeds from the offset really. Synergi has really helped our voice to be heard. And I would say that's in it's not in a really direct way, it's more in like a subtle way. It's like because Synergi has raised this on the agenda of some of the leaders in our city and has created this like environment within our systems where people like are okay to talk about this stuff. And it's also challenged some of the barriers that people face to talk about it. And kind of made people examine, you know, their own motivations and their own racism and things like that in order to come to this point where we can work collaboratively together. So organisationally, that has really helped us to, I guess, be on the agenda and be listened to and heard. And I am very proud to tell you that we now have a suicide prevention contract across West Yorkshire addressing suicide for Gypsy traveller communities, and I believe that is the first ever suicide prevention contract in England for gypsies and travellers.
My name's Pip Goff. I work for Forum Central, which is a network of third sector, voluntary, community and faith organisations working around health and wellbeing in Leeds. We've got about 250, 260 member organisations who are all really passionate about improving the health and wellbeing of communities. Our network connects people from those different organisations as representatives and partners and collaborators to other people across the system. We're really fortunate in Leeds that we've got a really strong, diverse and really active, proactive third sector. So making sure that that's valued and recognised, that it's part of decision making, but also that it's as good as it can be, that we share good practice, that we challenge back to the third sector, that we make sure that people and communities' voices are always at the centre, is also part of what we do. In terms of Black Lives Matter and the response to that kind of very strong need to act and be proactive, I think that really kind of got people from third sector organisations to really think quite differently, that they needed to do something about the racism and the challenge that we knew was there in the system, that we talked about for so many years, but that actually we just needed to really do things very differently, that talking about it and knowing it was there wasn't enough. So I think bringing that in sharp relief, I think, was very helpful. And certainly as a network of third sector organisations, we started meeting together to have particular conversations in response to the Black Lives Matter agenda and that challenge to do something very practical and tangible that got us asking Black and other minoritised kind of workers from third sector organisations to talk about their experience and their solutions, to think about reporting of kind of racism and hate crime, to think about data and how differently we could start capturing the actual reality of the situation. So those conversations have been really helpful. But we're particularly proud that we're now working with public health and other partners to have the post that's focused on children and young people and health inequalities in mental health. So we have Marvina in post, and she's able to go out and have conversations and share information and just be that real connector between communities and really make sure that it's on the agenda in a much more powerful way.
My name is Marvina Newton. I am the Mental Health Inequality Lead for Children and Young People for Forum Central. But I actually stepped into this role from some of the work I've done as the founder of Black Lives Matter Leeds, where we did a project on Being Black and Being Me, which was looking at children and young people's mindsets and the impact of racism or institutional racism on their mental health and well-being. As an activist, I find that this role gives me the opportunity to look on a strategic part on how to make sure there's an equitable access to services when it comes to our community. And when I say our community, my role extends more than the Black community. But what I know that I can potentially do is bring that representation and visibility in holding system leaders accountable to what we need to see happen. Before you invite someone to your house, you're going to ask them their dietary requirements. You're going to make sure you cater to their dietary needs. What happens is that I'm not going to invite you to my house and then feed you whatever I have at home and expect you to take it. That's what happens with our healthcare system. We are creating systems without speaking, and I mean not the tokenized gauging of stats, really going to the grassroots of young people and children and saying, what do you need? Let me get your voice and your influence. Let's build this system together. System leaders, I need you to become better allies. That's the message I want to actually go across to everyone listening to this. The first thing is that to be an ally, you need to act. Act on the inequalities that you see. If you know a system is not catering and you can see that the diversity is not in your workforce, in your training, make sure you do something. You need to listen to the communities that are being affected, listen to the communities that are not being incorporated in your system. That means you have to make sure it's active listening, not you trying to respond in a defensive way.
I'm Delvina Saunders, and I am the Mental Health Ethnic Inequalities Lead for adults, and that post is hosted within Public Health Leeds, with Leeds City Council as well. And the role is very vast, but it is supposed to concentrate on the overrepresentation of Black and other minority ethnic people being detained under the Mental Health Act. And we're looking at priority 2 in particular of the strategy to see how we can try and reduce some of those mental health inequalities for people. And my role allows me to be able to speak and do things with people in the community, and also other third sector organisations as well as other statutory services, and together we come together to have those conversations about how we put things in place to make a change. The grants process has been a firm favourite of mine during my position, just simply because I've been able to witness very small grassroots organisations flourish, having never had any previous funding before, but now having the opportunity to use that funding to make further impact than they already were. So with the grants process, it was put out online via Leeds Community Foundation, and it was advertised towards the end of December 2020, and the applications for that closed late January, and it was very heavily oversubscribed, which is very telling about the demand in which people are ready to help, but they don't have the funding to be able to do so. The particular, the name of the grant was Addressing Mental Health in Ethnic Minority Communities, and when I've spoken to some of the grant holders that were inquiring previously before, numerous of them had these fantastic ideas of how to run a programme, how to run a programme that's going to reduce mental health inequalities within children, within families, within adults, and they were the 3 different areas that we were focusing on, and we wanted to make sure that all 3 of them got the same kind of equal attention. So in the end we ended up picking 6 children and young people organisations, and also 8 adult organisations. And some of those that were in there were organisations that were already well established. However, they were partnering up with some other smaller organisations, which was great because it was an opportunity for the smaller organisations to learn how to treat your funding, how to move forward and grow your own organisation. Another part of my role, and another really important part of my role, is being a part of the Synergi-Leeds creative spaces, and that is a space for us to be able to create something where we can showcase some of the work that has been done surrounding mental health inequalities, an opportunity for us to really get a better understanding from statutory services and also the third sector about what changes they're making within their organisation to be able to address this agenda, and also an opportunity for some of our service users and carers to have some input in how we shape the changes that are going to be happening surrounding this as well. So it's a really important part of the work that we do in having people involved, but also having people understand why we're doing it as well.
My name's Lutel James. I'm the CEO of Chaptertown Youth Development Centre, which is predominantly a young people's organisation, working with young people from 4 years old right the way up to 25 with multiple activities. We've been around for 20 years now. We started in maybe 2001 officially, and then we've worked right the way through till now and sustained the organisation. There's over 1,000 plus young people on a weekly basis engaging in positive activities. The activities range from gang prevention programmes, employability, mentoring and coaching, boxing, rugby, educational support, and a wide range of programmes to engage with young people in a meaningful way. I grew up in Chaptertown. I'd wanted to be involved in positive activity and sports for a long period of time. The accessibility wasn't there, the availability wasn't there, and at times I felt socially isolated. So mentally it had an impact on me, but then I became vulnerable to go out there in the streets and run wild. So ultimately the people who I wouldn't want to take me in their hands actually did, and that took me down a different avenue, which was to get involved in all kinds of crime and negative behaviour. When I got an opportunity to play full-time football, it was the catalyst to change for me, because I started to see how others lived, and I know there was more things in life accessible and available. So when we came back to set up the organisation, it was based on that principle. How can we support young people making more well-informed choices at the earliest possible point to not make some of the errors like I made? The funding that we received as an organisation was massive, and it was based around the stigma of young people and black people, blasé, parents and all the rest of it around mental health. It's not something they can talk about. It's not something that they want to acknowledge. It's something that's seen as, well, if I admit that, it's weak or I'm mad or I've gone off the rack and I'm not compass mentis, and it's sometimes create family embarrassment. If every child from the early ages right the way through to adulthood, if we don't understand working with young people that every stage of their mind matters, so their design, their understanding, their feeling, their emotions, their anxieties, their challenges, if we don't go through a process with them and every element of their mind matters through all them stages, then we're going to lose them somewhere, because we're not considerate about how you feel about that. It's okay saying we're putting on this, this and this, that's great, but then if you don't look at each area of that delivery and see how it affects that young person in a meaningful way, good, bad or indifferent, and you're not assessing that, then what you're doing is just going through a process and dragging them through it. We've got one key worker that kind of manages that area of work, and that key worker will have engagement with parents, so the key worker will facilitate parents' meetings to talk about how important it is to even talk about mental health to your young people. But equally, how important it is for you as parents to understand that you've got a part to play in this as well. So the key worker will facilitate and get support of, say, another 6 or 7 volunteers to facilitate workshops. Then workshops will be in depth. It'll explore how you feel about mental health, how it's seen within your community, how it's seen within your home. Is there any experiences of mental health, and how did you feel about it? To start breaking down and dissecting the real feeling around mental health, but then equally starting to get them to understand why it's important for your young people at this point to have a clear understanding of, it's okay, mental health's a key thing that can be supported and it's not to be ashamed of. So the workshops is one thing. You then do the workshops throughout over many young people, but then you start highlighting a much more in-depth need where there needs to be one-to-one sessions. So now we're going to be training 2 other volunteers that's going to share the one-to-one sessions, because the ratio ain't going to work out where the key worker is able to facilitate them. So we're starting to train other people to go and support that. But what it's doing is it's giving the overall perspective and that attention to detail around mental health. But what it's doing then is also going into depth with individuals who need more support. Then at times we have to look at our capacity. If we haven't got the capacity to see it to where it needs to go to, then we've got to refer and to support onto specific agencies that specialise in that, and that's all they do. Because what we don't want to do is be detrimental to young people saying we can achieve everything. We'll do our bit, which might just be engagement, understanding, connectivity. And if you can do that and connect many young people to services that they might not ever have accessed, then that's a winner in itself.
My name is Lorna Muteto. I work here as the family support worker. My job is basically to engage with the families within the area. A lot of my work is to do with families from diverse communities, and it's basically trying to get them involved as much as we can in this local community centre, make them feel like they're a part of the community.
I'm Andrea Edwards. I'm the Chief Executive Officer of New Wortley Community Association. What we do here is about listening to people. We don't decide what we do here. We listen to what the community wants and we help them. The original idea to start the Cultural Cafe project, it wasn't actually the Cultural Cafe which was the first step of the process. I quite often would sit in the Wellbeing Centre and see lots of non-white British families going past the community centre, taking the children to school and not engaging with the community centre, not even really noticing the building was there. And that was an issue for me because it is about looking at the changing need of this community. It was very traditionally a white British area. It's not anymore.
Well, I set up an English communication skills class in cooperation with Leeds City College, which is based in Leeds. And from there, it evolved that a lot of those ladies had skills, had things that they could do, things that they wanted to do other than learn English, but English was the barrier. And because of that, they tended to isolate themselves at home. So it came about that we thought, we'll put on a cafe, you know, we'll get some volunteers involved, put on a cafe, because obviously we like food, don't we? Cultural people, we like our food. And it was also to educate those non-black and ethnic minority people in the community that, you know, we exist, and that the food is something that we use to kind of engage. So we set up the cafe. It started off a bit rocky at first. It's quite hard to get these people to come in and trust you. So they came in and I told them that, you know, we're going to try and put some food on to sell to the community and just put on some music and do some crafty things and ask them what kind of things they could do. So some women could do knitting, some could do sewing, some could do weaving, crochet, so on and so forth. And we started off by doing little cafe projects alongside the cooking.
Things evolve organically, they evolve naturally, so it's really important that people feel that sense of belonging and feel the ownership around what the next steps of a project are.
I think the next step for us has to be talking with system leaders about the leadership and management of this. And when I say systems leaders, I also feel a bit uncomfortable because it's not just about systems leaders, it's also about those who represent the service user and carer voice in this, about how do we sustain this, and we had some really generous funding, have generous funding from the CCG for this project, but there is something about anchoring this work somewhere within the city, and I'm not even sure I'm necessarily saying anchoring it in a statutory body or the voluntary care sector, but where does it fit so it can thrive and stay true to its values and principles?
I do this for the culture, for the diaspora that died before us, for the tribes that triumphed over nature with nurture, whose hands come form fire. Cave carvings, art in the Nubian kingdom of Kush, 6,000 years before Christ. I do this for the culture, for the garments that guard us, from the daishiki to the kuftan, to the kanzu and mediba shirts, saris, longis, sawar kamises, hoodies and tracksuits, turbans, head wraps and skull caps. Yes, we does this and done that, adorn in silk. This is more than a business. I do this for the culture, for the elders that held us, that went through hell first, that went from being dragged onto slave ships to being dragged off from Delta, dealt hands. Don't move, put your hands up. Watch the world spin, fam, or you miss where it turns on you. Axes, X marks the spot, and Y is the number of bullets that fly through us every day. I do this for the culture, for the children, for the Maijis, for my famalam and the our kids, for the writers that are righteous, that do right for us, for the dreamers, for the 3 a.m. window gazers, for the bodies that only remain a memory. Mark Duggan, Anthony Walker, Stephen Lawrence, Altab Ali, Baby P, Rhys Jones, and for the bodies the world doesn't acknowledge. I do this for the culture, for my mother, for my sisters and my brothers, for my father, for my cousins that I introduced to you as my siblings, for the old school, for the far to a bed at the stayovers, for the late night conversations of what if. I do this for the culture, for the words, for every moment of silence that was forced upon us, for the reminder to remain calm, for the tin roofs in the villages, to the stories in mother tongues, to the glory stored in drums. I do this for me, fam. The only thing that they can't control is my tongue, my pen, and my thoughts.